afternoon, doctor. This is DCTV Interview. Please, can you tell us your name and what's your, let me say, your field of work here in Bavaria Hospital?
Thank you very much. I am Dr. Stanley Bona, a consultant physician and endocrinologist. Here in Bavaria, I am the person in charge of their internal medicine specialty. All diseases that come under internal medicine, be it heart diseases, endocrinology diseases like diabetes, thyroid disorders, and all that. I take care of them. So here I'm in charge of internal medicine and all that that come under internal medicine.
Okay. So before you here is a patient whom you want to tell us what you want to do on him or maybe treat about.
Okay. All right, thank you. Here, this is ECG, electrocardiogram. Okay, it's called electrocardiogram. So the ECG for short is a machine, is an instrument one can use to determine what is going on inside the heart. You know, the ones the stethoscope cannot pick. You know, essentially it detects electrical activities in the heart. So if there are some heart diseases, they can show. So if you run the machine, it prints out something going to show that. It prints out a paper, the electrocardiogram. That paper will now show you exactly what's going on inside the heart. So that if there's disorders of rhythm, that's the heart beating abnormally, it will show you those that have hypertension, those that have other cardiac diseases, so it will show in the ECG. So this ECG will help you to know that this person has some heart disease. So most times, a lot of people have heart disease without knowing about it. But as a matter of fact, any adult who's up to 30 years and above should be subjected to this ECG test at least once a year. Those who are up to 40 years can do it once every 6 months. Then if somebody has hypertension, definitely you must do it once every year to ascertain the status. So that if the person is already developing features of hypertensive heart disease, you can use this to pick it. I'm here in Bavaria, and I think that's the only place where you have it in Okigwe. So I think people should make use of this opportunity.
Okay, and when you discover any sickness or any activity, abnormal activity at the heart, what do you do?
Of course, a good number of them are treatable with medications. Then there are some that will require what we call pacemaker. Then pacemaker, not many centers start pacemaker in Nigeria. I just have a few centers, maybe a couple of them in Abuja and Lagos. Even Enugu, sometimes they do it in Enugu, where the person can go and get the pacemaker inserted. Like we've had 2 cases where we diagnose here. We have to, because the pacemaker insertion, we don't do it here. It's quite procedure. We don't do it here, but I believe with time, we can still commence doing that. So some of them, a good number of them are treatable with medications and other measures. But quite a few of them, like even those that have congenital heart disease, you can still pick it with some of these, the stethoscope and then the ECG. Then you can now send to a center where they can do the cardiac surgery or the open heart surgery as it is maybe.
Okay. Do you have anything more to tell us about your specificity?
Okay, yes. In this specialty, I want to encourage people living around this environment, Okigwe and its virus, to take advantage of this opportunity. Like here, we handle a lot of chronic ailments, like chronic liver diseases, diabetes mellitus and its complications. We handle other cases like hypertension and its complications, rheumatoid arthritis and their complications. A lot of all this, the infectious diseases of all types, including tuberculosis, complications of tuberculosis, even those that develop cerebrospinal meningitis. We handle quite a good number of them here. You know, so these are things we can handle in this facility. Okay, those who develop stroke and the complications of stroke can equally be handled there. Those who develop the diabetic foot ulcer, the so-called Okigwe, a good number of them just have diabetes and they develop ulcer who refuse to eat. So they can avail themselves of the opportunities available in this facility.
Okay. Okay, doctor, I hear you say achere. Are you trying to say that you people treat achere absolutely very well to ease?
I can say yes, because most 90% of the time, what people refer to achere is just diabetic foot disease. You know, somebody developed the ulcer, wound in the leg that refused to heal. Most cases, when they come to the hospital, you run a check and find out that their blood sugar level is high. In other words, this person has diabetes, but without knowing it. But most people, a good number of people that have diabetes are not aware that they have diabetes. So that's actually how to find out that they have diabetes. So if they present, then that's taken care of. You now see that the so-called achere has been cured. So instead of believing that someone somewhere did something to you, it might just be out of ignorance that this person is carrying the food like that and is not coming to seek medical care. So in that regard, I can say yes, we can handle achere.
Is it that you can handle or you have handled in the past?
A lot of them.
Okay.
We've handled a lot of them. People would have taken it also, maybe thinking that someone did that. Every number they keep coming in here. The only challenge is, of course, the person will have to be in the hospital for a couple of weeks because the wound takes a while to be taken care of. You have to first of all control the blood sugar, be subjected to debris more and all that. The plastic surgeons come to help in managing the wound because it's a chronic, or we call it chronic ulcer. The ulcers have stayed for a long time. You know, sometimes it will require grafting. You know, grafting of skin, bringing skin from another part of the body like the thigh or the back, and then using surgery to fix it where you have the ulcer, to cover the ulcer, then you would allow the ulcer to what we call granulate, become kind of healthy. Then you bring harvest skin from another part of the body, use it to cover that. That's another sort of type of management for them. In some cases, it may require what we call re-amputation. Maybe you might require 2 or 3 toes to go so that the other part of the foot can heal. So these are some of the measures we've done in this particular center.
Okay. Now, what can you tell to a poor family who sees this video and desire to be here to obtain treatment but is afraid of the financial status of this treatment? What can you
actually
what does doctor, what does the health insurance can you go?
Health insurance available here.
Okay.
One can make use of that insurance facility whereby then apart from that there's also this call it indigenous people fund, whereby somebody is admitted, you look at what the person is suffering is a chronic ailment, maybe to require surgery and this person cannot afford the surgery. Then through that fund, okay, the person is meant to undergo surgery and then is taken care of through the indigenous people's fund. Okay, there's also health insurance whereby the person is admitted and then through that health insurance someone who is funding it can now undertake to fund the surgery or the treatment for the person. So finance shouldn't really be the issue. The important thing is a person's attitude to health. If the person believes or rather decides that he wants this to be treated and make himself available, there will always be a way. Once there is a way, there will always be a way.
Okay. Now you said about indigenous people. These indigenous
indigent people rather.
Okay.
Indigent people's fund.
Okay.
That's people who are poor. Let me say poor people's fund. Let me use that word.
Okay.
Poor people's fund. You know, people who are indigent. Of course, you will have assessed the person in government-owned establishment like teaching hospitals, medical centers. Such practices also take place. There's a unit called social welfare. You know, social work unit. You invite them, they come and assess the patient, trace the person through his address to where he comes from, and they do the investigation to establish that this person is not playing some prank and he's really indigent. Then you go ahead to declare him in the hospital. They say they declare the person a pauper. Then the hospital cannot take up the bill. Here, the Indigent People's Fund will now take care of the person's cost of treatment. But then you will have established that this person is not really trying to be smart. You know that this person is really poor and cannot afford the treatment. But as a matter of fact, the person needs to be treated so he doesn't die from something that's treated.
Okay. Thank you, doctor. And the last but not the least, you have explained your field of work here. Can you just explain to us or show us the machine which you, in your own work, use here in Bavaria?
Okay, like the ECG is one of them. Like here, this is the ECG machine. Okay, so when we connect these are the leads. We call this chest leads. These are the limb leads. The hands and the legs are the limbs. So these are the limb leads. So we connect them. They use gel to make these things to stay. Okay, the same gel that is used in ultrasound. So you use it to make it to stay. Once you connect them, then you put the hands C1, C2 to C6. 6 of them.
Okay,
so
doctor, I will leave you to comfortably do this later. Okay, and outside this machine, do you have any other machine which you can show our audience?
Okay, well, not immediately. Maybe in the course of your interview with my colleague, I'll get that ready.
Okay.
I'll still have other machines.
Okay, thank you, doctor, for this opportunity to the audience. We hope that after this video, people will be inspired to come to Bavaria Hospital and get a perfect treatment and at affordable cost. Thank you, dearest.
Thank you very much.
Good afternoon, doctor. This is DCTV interviewing you at Bavaria Hospital. Please, doctor, can you tell us your name and your field of work here, or specification of work here?
Well, I'm Dr. Alex Chukwulebe. I'm a consultant surgeon with specialization in general surgery and urology. I'm in Bavaria here as the Chief Medical Director of the hospital, Bavaria Specialist Hospital.
Okay. Doctor, when I earlier came here this morning, I almost greeted you, Reverend Father, good morning. So, and you look sincerely like one of them. So, and I learned from Reverend Father Josephat that you were once a seminarian. So can you tell us what inspired you into moving into medical field, and then so far so good, what you find fascinating in doing what you do?
Well, as a child, I was in the seminary. What made me leave was divine providence, because I cannot really recall exactly how it happened, but I just found myself outside the seminary. And being in a school then, Okigwe Secondary School, Okigwe, where science was given a prominence, I ventured into the science subjects. And when I was choosing a career, I saw medicine as something very close to the Reverend Father's job, so I had to switch over to it. And right now, as a surgeon, I think I'm very much fascinated doing surgeries on patients and helping people to recover from different illnesses, surgical illnesses, where there is less competition from charlatans, from quacks, from people who are not well trained. Especially those who prescribe medicines here and there. In Nigeria, there is poor regulation of practice. So a lot of people venture into different practices, but not secondly to surgery, which is our area of specialization.
Okay, wow. So as a surgeon so far in Bavaria Hospital, have you had in the past failure, or let me say, have you lost any of your patients?
No, we haven't lost patients as such. We choose our patients very well, and we make sure we choose cases that are easy for us to handle. Because we have other hospitals around us. UNTH is just 1 hour away, where I recently retired from. And Federal Medical Center, Umuahia is also near, just straight express road. Then those who wish to go to where they also go. But of course, there are some very serious emergencies like gunshot wounds. You know, Okigwe has been a very security volatile area recently. So sometimes people come and there's very little you can do for them. So some of them die, others are saved here, and some go to other hospitals. So, but generally, when we get some elective cases or cold cases, we try to do those ones within our capability, based on facilities available and personnel. You may be a surgeon, if you don't have an anesthesiologist around, your hands may be tied. So, we have a visiting anesthesiologist. We don't have resident anesthesiologists as of now. So when we have them around, the skies are our limit. So in terms of facilities, this hospital is well equipped to do so many things here. We have equipment like ultrasound machines, radiology, equipment like X-rays, DCT. We even have AED, which is used for cardiac resuscitation. We have it here. Father got it, one Reverend Father from Germany donated it to the hospital. So it's quite a very rewarding place to have in this subject region, this environment, rendering service to the rural people in Okigwe here, under the umbrella of Okigwe Diocese.
Okay, to the people surrounding this hospital, especially people within Okigwe jurisdiction, and to people who might see this video and be interested to visit Bavaria Hospital for personal treatment, what is your advice to them towards their financial status and as regards to your treatment, or to people who are poor or who cannot afford or who feels that from what you have said, I mean, this is up to standard to an extent. So what can you tell them? What is your advice to them of coming or not to come as regards to their financial status?
Yeah, Bavaria gives subsidized treatment. The cost here is very affordable. Some people have insurance too. The Reverend Fathers are insured and they all come here for treatment. So we try to make it affordable, and sometimes Bavaria opens its doors for free medical treatment. Recently, we had a lot of people trooping here, especially when there was crisis in Okigwe and Umulo or Axis, and a lot of people were rendered homeless. They were all ported here, they were fed. And thereafter, people who were sick, they were all treated. Even surgeries were done, both general surgery and eye surgeries. We have ophthalmologists who helps us in treating eye patients. And they did a lot of cataract surgeries, pterygium treatment, and glaucoma treatment and all that. So this is a mission hospital, and funding or finance is not really one of the handicaps to treating people. We try to understand and offer them treatment. Sometimes people from overseas, through Reverend Father Dr. Joseph Atmoko, funds certain aspects of treatment, and it makes it easier for the patients to access.
Okay, thank you, Doctor, for your response to the audience. DCTV, we hope to get back to you. Thank you so much.
Thank you very much.